Hello, my name is Dr. Chris Blatchley from the London Migraine Clinic, and I'd like to tell you about the research they've been doing um, on whether Daith piercing can help migraines. We first heard about Daith piercing around about 4 years ago, and our immediate response, I have to say, was that it was probably placebo. But we decided that if we were going to arrive at that conclusion, we should at least check our facts. Since then, our research has surprised us, and I'd like to share with you our journey and why we have changed our minds. Daith piercing was initially invented in 1992 as a cosmetic piercing, and it soon became popular, partly as a cosmetic piercing, but very much so because people started reporting an unexpected improvement in their migraines, and this spread on chat rooms and the like, and as it became more popular, it spread more. Eventually, it went viral on social media when Dr. Thomas Conn, a pain doctor, put it on his website. And since then, many thousands of people have had a Daith piercing, and reports of migraine improvement have continued. When doing our initial research, there are several stages to this. First of all, is to check what research has already been done, and we found that there was no medical research at all, and only a few amateur surveys of small number of people online. So we decided that the first step would be to do a medical grade, large scale a survey with far more questions for cross referencing. And you can see the results of this on the London Migraine Clinic. Now, the results of our survey were actually very similar to the survey that we looked at from someone else. One element that was very interesting was, unexpectedly, and it had not been mentioned before, was that many people were reporting changes in migraine symptoms immediately after piercing. So we decided on this basis that more research was needed, and we should treat and follow up our own patients. Our patients indeed confirmed this and reported and immediately reported reduced pain in the head, neck, jaw, reduced brain fog. Brain fog or confusion and slowness of thought is a very common symptom and can be worse than the pain for some people. They also reported reduced visual symptoms, including photophobia, dislike of bright lights, and reduced visual discomfort when looking at strong black and white patterns. And so the question came, could we measure this? Now, I was speaking to my colleague Arnold Wilkins, who does the research with me, and we were discussing that something that has been known for a long time, that high contrast black and white patterns cause intense discomfort for migraineurs. So could we measure this in some way, immediately before and after piercing? And would the changes, if in this, if they were there, mirror the changes in other migraine symptoms? Arnold had already developed a tool for looking at this, using gradually increasing patterns with gradually increasing contrast. And you can see this here, there. These are the patterns. Those are a selection of the patterns. And we would ask people, as they went through the range of patterns, whether the that they were receiving any discomfort on a scale from 0 to 5. And we did this before and after the piercing, as I mentioned. So there we are. And we go, and here are the results, which are fascinating. The top line is the discomfort that people described immediately before the piercing. And you can see, as expected, that this is the line with the white circles, that it's gradually increasing as the contrast of the patterns increases. Now, the second line, there we are. The second line is after the piercing with the black circles, and it shows consistently that there is a reduction in the discomfort. Now, that's all well and fine, but as an academic exercise, if it doesn't have any long-term effect, then there's not much use in a clinical setting. So we then started following the changes in symptoms. And the initial question was a simple one, which is at about 1 to 3 months, we asked whether there was a change or no change, and if there was a change, whether it's little or great. And we then, with other questions, looked at several other symptoms, including the number of headache days. And as you can see here, there was a smaller group of 8 out of 34 that reported no change at all. And that's reflected in the number of headache days. Then there was a larger group, who reported a significant change. And either they reported little or great. And the number of headache days on average over this group was a drop from 14 days to 4 days. Now, if you look at the number of divide the group into little or great change, we find that the great change group had an increase in drop in a reduction in headache days down to 2. It was greater. So the numbers were consistent. Now, one of the things that was coming up as we were piercing people, there appeared to be a very significant difference in no change to change in what people were describing. It was either no change at all or a change, and we measured this by looking back at the groups, and we found that the people that recorded no change did not ever have any severe visual discomfort. In fact, they whether or not they had symptoms before the piercing, in fact, they generally didn't have any visual symptoms at all. Whilst the people reporting change, whether little or great, had a significant amount of visual discomfort when looking at the patterns, and this dropped, if I can find there, from 15 out of 26 who reported severe visual discomfort down to 3, and immediately after piercing. We also followed through for a longer period of time, for 12 months, and as you can see, 11 of those 26 were reporting great improvement, or the migraines had stopped. So, this is all very well, but can it help severe migraines? So we followed up from a larger group. There were 30 patients who had migraines for more than 10 years. 6 months after a Daith, 5 of those 30 did not respond at all to the Daith piercing, but 25 did, and about 2/3 to 3/4 were very happy or delighted with the Daith piercing, the results of the Daith piercing, and reported that they found their migraines greatly improved or stopped. Now, if we look at this in detail, we can see that the severity of the migraines as measured in the frequency of headaches, and indeed the severity as in painkillers taken. Now, if we look at the ones with very severe migraines, there were 7 out of the 25, they had migraines 4 days, more than half the time. And the migraines, the people that had migraines less commonly were 1 day or less, were actually very few. There were 3 out of 25 that had 1 day or less a month. And totally, for instance, symptom-free days is another measure, and we find that the very few people had significant numbers of totally symptom-free days. Now, what happened after 6 months? We could see that there was a great fall in migraine days and symptoms and severity, so that whereas 7 at the beginning, 7 out of 25 were reporting migraines of 4 days a week or more, only 1 out of 25 was reporting it in the most recent month. And conversely, if they had very few migraines, looking at the numbers with only 1 day, the numbers rise to about half as the severe migraineurs find that their migraines are getting better. And totally symptom-free days mirrors this. The painkiller consumption drops as well, and the HIT-6 score, which is a technical score about the severity of migraines, falls from 69 to 56, which is a significant change. Now, if you're getting you're suggesting that Daith piercing might be working, and it's not just placebo, then it's one should be able to at least have a theory, a hypothesis about how it's working. Now, the Daith piercing passes through the crus helix, which is a ridge of cartilage immediately above the ear hole, the auricular canal. You can feel it if you put your finger in your ear canal and move upwards. The innervation of the ear is complex, but that area of the ear is innervated by a branch of the vagus nerve, the auricular branch of the vagus nerve, and electrical stimulation of the vagus nerve is an established treatment for migraines. But the Daith piercing isn't electrical, but cartilage piercings take a very long time to heal and are irritating the nerves and the tissues for a considerable length of time, and it could well be, though it's not yet proven, that this is stimulating this irritation is stimulating the vagus nerve. But certainly it's also true that no other ear piercing has been reported as having an effect on migraines in the same way as the Daith does. So overall, our research suggests that there may well be a real effect beyond placebo. 20% get no response, 40% get a short-term response, but 40% are getting a good response that lasts for a long time. And such a good response for such a long time is difficult to... it suggests that this is more than placebo. The positioning of the piercing may well be important as well, because the area innervated by the vagus nerve in the ear is small. So, because Daith piercing is not an expensive treatment, if we can find that the initial findings are confirmed with new studies, then Daith piercing could become an important treatment for migraine. However, A word of caution: we have not yet excluded placebo. Our numbers are small, and will the results be the same in a larger group? However, the response to patterns appears predictive, and there is very little effect in those without visual symptoms, and both those help support the idea that it's not, at least not only placebo. Further research is needed, and there are still many other questions that need answering. So for further information you can visit our website, and thank you.